Hi, everyone. Thank you for attending Expert Advice on Preserving Your Fertility Future. I'm Holly McHugh, the Digital Marketing Specialist here at FCI. I'm really excited to be here with you today. We have a great panel of experts here to talk to you about egg freezing. And before we get started on that, I do just want to go over a few housekeeping items. First of all, this webinar will be available on demand. So we are recording. You will get a recording within 24 hours of the webinar. And it will also be available on our website and on our YouTube page. Before we get started, I also want you to know that we have a Q&A function. So there should be a Q&A button where you can ask us questions throughout the webinar, and we will answer all of your questions, or as many as we can anyway, at the end of the webinar. If you do have anything that's personal to you, we do ask that you schedule a consultation. So please keep your questions open-ended, and we will answer them as many of them as we can. And we encourage you to follow us on social media, on our Instagram page, Facebook page. We're also on LinkedIn. And we share a lot of really great information there about different topics from our physicians, about boosting your fertility, things to consider if you're trying to get pregnant, and the processes of different treatments that you might get here at FCI. And then finally, really exciting, we will be choosing 10 attendees to get a free year of egg storage if you get your eggs frozen at FCI. And we have all of the terms and conditions on our website on the event page for this event. So go to our website if you have any questions about that. So during this webinar, we are going to go through a brief intro to FCI if you're not familiar with us. We'll also go through egg freezing basics, followed by 5 common myths and misconceptions about egg freezing and talking you through those. We will talk you through the egg freezing process and then finally finish with that Q&A that I mentioned at the end. With us today are your hosts, Dr. Hirshfeld-Cytron and Dr. Burks Chatmon, reproductive endocrinologists here at FCI. They are amazing. We also have Lindsay Vero, who is a registered nurse at FCI, and Judy Petrusik, the financial services coordinator supervisor, to walk you through affording treatment. So just a little bit real quick about FCI. We have 11 physicians in 8 locations throughout the Chicagoland area, spanning from the south suburbs to the north suburbs. We have over 35 years of experience, and more than 42,000 babies have been born from FCI. We are the leaders in egg freezing since 2004, with over 17,000 eggs frozen, which is more than any other clinic in the Midwest. So without further ado, I am going to pass it over to Dr. Hirshfeld-Cytron to talk about egg freezing.
So thank you so much to everybody who's listening. We know how busy you are, so thank you for including us as part of your night. The goal is going to be to talk about what egg freezing in generalities, some of the myths we think are important for you all to hear, and then at the end, an opportunity to ask your questions. Lindsay is so amazing. She's going to talk about the cycles and what to expect and side effects. And we're lucky to have Judy as well to answer financial questions. So we're so super excited you're here. What is egg freezing? So the goal of egg freezing is to keep your fertility potential at its current state. The idea is there's a cohort of eggs that would otherwise go unused every month that become stimulated to develop and mature in the context of the cycle. The eggs are then removed with maybe a 10-minute procedure under anesthesia like twilight and frozen to be used at a later time. And so although in every way, probably 40 is the new 30, and 50 is the new 60 or what have you, the way we live our lives and our longevity, our ovaries really haven't caught up. So this whole idea of egg freezing is, how do I freeze my eggs at a time when they're at their peak reproductive potential? I don't know if I can, do you mind flipping the slide?
Yeah.
Um, so yes, please.
Sorry. So I am Channing Burks Chatmon, and as Holly said, and I am really excited to be here with you guys today and to do this webinar. So Dr. Hirshfeld and I, fertility preservation and egg freezing is something that we're really passionate about. So we really are excited and thankful for you guys to join us. So, why do women freeze their eggs? It brings up a good question. And so as Dr. Hirshfeld said, so even though in 2022, we've come a long way with other pieces and aspects of technology, this is really your only way to preserve your fertility for the future. So a few of the main reasons why people do it electively is if they have not yet found the right, partner, Mr. Right, the one that they can see themselves building a family with, or perhaps they're pursuing, career goals into their 30s. And so they decide to do egg freezing for that reason. The other main reason that women do it is really if they have any medical diagnosis that they've been told or they know can negatively impact their fertility. And the major one in this category is usually if they're diagnosed with cancer in their 20s or in their 30s. Next slide.
You're on mute.
Yeah, sorry, my house is so loud, so that's why spare everybody the dog. But there's always like the lingo, and so the goal here is just like decode some of the things people say. Oocyte is egg. Sometimes people say oocyte freezing or oocyte vitrification. That's just egg freezing. Follicles are immature eggs that an immature egg is surrounded by nurse cells. So the follicle I would think of as like an egg surrounded by nurse cells. And when we look at an ultrasound, we will use the term follicle and egg interchangeably as well. So unfortunately, we create confusion unnecessarily. An embryo becomes an egg that is fertilized with sperm. Vitrification is the technique we use, the fast freeze. That was the game changer for egg freezing that made it so much more effective. A blastocyst is now an egg that's been fertilized into an embryo that has developed about days 5 or 6 of development. So now we're going to head into the 5 myths and debunk them. And Dr. Burks Chatmon is going to start with our first one.
Yeah, so myth number 1, egg freezing is a brand new technology. So that is not exactly true. So we had our first human birth from a frozen egg or oocyte in 1986. It was used in a cancer patient. So this was kind of our first use of the technology for patients that had cancer and that were trying to preserve their fertility. Then in the early 2000s, as Dr. Hirshfeld mentioned, there was a big game changer as far as our technology. So we shifted from something called a slow freeze of eggs to a fast freeze technology or vitrification. So this, with this technology, we saw much better success rates. So ability to thaw eggs and have them survive that thawing or warming process. And then also more eggs that were able to be successfully fertilized with sperm. So with these advances, we saw a huge increase in not only elective egg freezing, so for the reasons we talked about, either women who might be pursuing career goals or who haven't found Mr. Right, but also it has led to the emergence of donor egg bank. So for women who might not be able to conceive on their own with their own egg, this offers another alternative for them to use. So eggs from a donor. And then finally, I just want to share that FCI is a member of Donor Egg Bank USA. And this is important because it's one of the largest egg banks in the country, and FCI is the only partner that they have in the Midwest. And so the reason I think it's important and I want to share it with you is because it means our lab undergoes additional scrutiny measures or quality assurance measures, which means our success rates are closely monitored. So that means that we are able to guarantee kind of a higher success rate as far as thawing eggs after the egg freezing process. So because of the things I just mentioned, the number of women who have frozen their eggs has drastically increased over the past decade, almost 2,700%. And as many of you know, as you see in this quote, a lot of celebrities have started to open up and share their own experiences about egg freezing. And regardless if it was positive or negative, we're just thankful, in our FCI community that they're sharing their experiences and, promoting fertility awareness.
So myth number 2 is you can freeze your eggs at any age and expect the same result. So women are born with all their eggs they're going to have. So we actually lose the majority of our eggs in fetal life, which is kind of crazy to think about. So at birth, we have somewhere 1 to 2 million eggs. At age 30, you have 12% of your eggs that remain. At age 40, we have about 3%. And so this is, in a sense, why fertility awareness is so important. And so things that we have sort of looked and seen, about half of women are unaware that fertility rates decline between the ages of 30 and 45. So our fertility probably peaks in our late 20s. And there's a decline that occurs in our 20s. And there's the more sharp decline we think about in the mid 30s. About the same idea, but just over half of women over 35 said that they would have made different decisions regarding how they went about potentially planning, whether it's having their family or freezing their eggs, if they had better fertility education in their youth. So the goal of interactions like this or meetings like this, so like Channing said about celebrities, is just to bring awareness. I'm not sure we're the best time to introduce this material. If it's high school, we have to think the goal of high school health class ultimately is to prevent unwanted pregnancy and to read, of course, concepts of like safe sex. So then where do we learn these pieces? More and more people are reinforced from their OB, but I think there's definitely a community whose goal is to educate. So when we think about egg freezing, the whole idea is that quality is really fixed to your age. No matter everything we have done and how much we've improved, we do not have a medicine that if you take, it recreates, it takes years off someone's ovarian reserve or someone's egg quality. So the strategy has become that we try to freeze at a younger age. So improve quality the younger we are. But what differs from person to person, so if quality is so linked to age, quantity is very individualized. And so how do we determine quantity? How do we determine this idea of ovarian reserve? Ovarian reserve is the notion that each individual would respond differently to freezing medicines for egg freezing. And each individual theoretically would get less eggs at time of egg freezing. So when you take the next step, we want to learn, okay, for me individually, how many eggs would I get? We look at an ultrasound, we count the number of follicles, called your antral follicle count. We look at your FSH level, early cycle or follicle stimulating hormone, and an estrogen that confirms that was done the correct time, and an AMH hormone. And we are gauging someone's reserve, but we are not gauging your fertility. I just want to say that again. So if you have low AMH and you have not attempted to conceive, you are not infertile. We do not have that tool. What we know is if you chose to do egg freezing, you would get less eggs than expected by your age. But it does not mean that tomorrow, if you attempted to conceive, that you couldn't. Which I just want to emphasize here because I've had some patients who have interpreted low reserve as infertile and then had undesired pregnancies. We just really want to make sure that we know what we're testing. We're testing if I did egg freezing, how many eggs would I get?
So myth number 3, I only need 1 egg to conceive a baby. So although we wish this was true, it is unfortunately not the case. So not every egg will result in a live birth, which is the end goal with egg freezing. So it must go through many steps to get from egg to baby. It has to survive the thaw or the warming process. It has to be successfully fertilized with sperm. It has to then be an embryo that can grow to the blastocyst or the day 5 stage that Dr. Hirshfeld spoke about. And then we put the embryo back into the uterus in hopes of you conceiving. So with all of this in mind, this is why it's important to know how many eggs you should freeze based on your age. So for women less than 35, we ideally would hope that you would have 12 to 15 eggs for a high probability or chance of having 1 child. So if you want to use this as an insurance policy for 1 child, 12 to 15 eggs. If you want to use it as an insurance policy for 2 children, then you might have to double that number or should double that number, which means it might take more than 1 cycle to get to the desired number. So how many cycles you do, how many eggs you should freeze really depends on your individualized goals. And it's important to discuss that with your doctor. But less than 35, 12 to 15 eggs per child. If you're greater than 38, the number does go up just because of that age-related link with the drop in quality. So the number doubles after 38. Patients always ask, how many eggs am I going to get in an egg retrieval cycle? And on average, it is 9 to 10. But as Dr. Hirschfeld just alluded to, it really depends on your ovarian reserve. So we use those numbers, that ovarian reserve or baseline testing, to try to figure out kind of where you are at along your reproductive lifespan. It helps us to predict or estimate how many eggs you would get in an egg freezing cycle.
Myth number 4, if I freeze my eggs, then future success is guaranteed. So although we all wish this was the case, this is where, again, exactly as Jenny had said, the number of eggs you get is incredibly important. That's the most important thing, is how many eggs you've frozen. I think Khloe Kardashian highlighted this for the whole world when she had her story about how she thought her eggs and that they was quote unquote good quality. And say what you will, this is another opportunity for people to bring awareness on an issue that's important. The number of eggs that you freeze is going to be incredibly important about how well this will work. And I wish there was, but there are not guarantees. So we look at some examples. We look at someone who's 38, and there's some assumptions. We're assuming how many eggs survive a thaw, how many of them fertilize, how many of them become embryos. And we know that there's the funnel. And so studies have told us what's the top number of the funnel you need. So at the bottom, you have enough. That's what we're trying to estimate, the number of eggs you need. So take someone 38, you have 10 eggs. 9 survive the thaw, so we expect a higher survival rate. 3/4 or so fertilize, we get to 6 to 7 embryos. 1 in 3 of those becomes an embryo that makes criteria to transfer. So you go from 10 to 2. And so those 10 eggs give you 2 opportunities of success. We expect each has about a 50% success. Now you're older, and we get 15 eggs. And 15 eggs is going to drop down to 2. I need more eggs, and I have 2, and their quality isn't as good because they were frozen at an older age. So again, the number you need is going to be dictated by your age, and that's stuff that's really important to obtain even from your first visit. Within FCI, it's sort of like the proof is in the pudding. So we have frozen almost 18,000 eggs, and we have thawed. So we have seen in our hands that when we thaw our eggs, we get similar success to the eggs that were never frozen. So about 1,400. This slide probably now could be updated just based on this year. We saw a clinical pregnancy rate of about 55 to 60 per transfer. And so we see similar pregnancy success, whether the eggs were judicially frozen or not. So that's really exciting. That's like the proof is in the principle idea.
Okay, so myth number 5, all fertility clinics are equipped, or we should say equally equipped, to do egg freezing. So, this whole process is important. I think I alluded to this earlier, and Dr. Hirschfeld also just mentioned it, but it's really important that you discuss when you have your egg freezing consult to try to gauge what is your clinic's experience level with egg freezing specifically. So eggs, generally speaking, are more fragile than embryos. That's why, we need the funnel, a lot of number of eggs to get a good number of embryos to have a reasonable or high likelihood of a live birth. So when you see your doctor for the first time at your consultation and you're just learning more about egg freezing, a couple of questions I would encourage you to ask them. What is your lab's experience with egg freezing and thawing? So how many cycles have you done? And then additionally, probably even more important, how many eggs, typically percentage-wise, survive the thaw? So that means when you're warming the frozen eggs back up to room temp so that they can be fertilized with sperm to create an embryo. And then also, how many live births have you had from egg freezing? So, I think if you ask those questions and you get numbers that you're happy with, then I think that's a clinic that's probably safe for you to move forward. If you get answers that you're not comfortable with, then I would encourage you to maybe look elsewhere, because how many eggs you get along with your lab success rate really dictates your outcome. And that's the reason that you're doing this, right? You're freezing eggs to have a high likelihood or chance if you need to use them in the future, that you can use them to have a baby. So it's really important.
So next, we're going to kind of highlight the egg freezing process. So this is sort of an overview about what's involved. And so in some cases, when you start a cycle, it's going to be egg freezing. You take birth control pills. You don't have to. It's one of the advantages of also being part of a large clinic, because we don't batch people. When you're ready, you're ready. When you get your period, typically within the first couple of days, you do ultrasound and blood work to confirm hormonally or early cycle. Your regimen has been created based on your initial testing. You've already met with your physician in between that testing and now. You take on average 10 days of injection-based medicines. 2, to create an opportunity for those follicles or eggs to grow. 1, that prevents them from ovulating, so that they're all held within the ovary. We're doing ultrasound and blood work every other day to gauge your dosing. Once the body is ready, on average, number 10 days from when you started, you do a final medicine, we call it trigger. 36 hours from that medication is the egg freezing cycle, egg freezing retrieval, excuse me. That's an ultrasound probe that's placed vaginally. The needle goes through the back of the vaginal wall to aspirate the eggs. So there's no incisions on the belly. That day feels like a painful period. The next day, you know how many eggs were frozen. A week and a half later, you get your menstrual cycle. And so restrictions that begin when you start the medicines, like avoiding intense exercise and intercourse, starts from when you start the medicines, continues for that week and a half to the retrieval, and on the back end, from the retrieval until your menstrual cycle occurs again, because that's when we know your ovaries are back to their baseline size. And so now we're going to meet Lindsay, who is been with FCI now officially a year, and one of our absolutely exceptionally wonderful nurses. So thank you, Lindsay, so much for being here.
So biggest thing, highlighting your next steps and just keeping in the back of your mind that your nursing team really is here to help support you through every step of this process. So remember that there is nothing considered to be a dumb question. We are here to make sure that you fully understand every process or every step in this process, and we're here to support you. So after you meet with your physician, you will schedule your initial workup that Dr. Burks and Dr. Hirshfeld highlighted. So this initial workup will be done on cycle days 2, 3, and 4 of your period. We'll bring you in for blood work and ultrasound. And as they highlighted, this will give your physician a good idea of where you are at in your reproductive journey, which will help them kind of determine what medication protocol will be best for you. Additionally, we will help you complete your checklist, which I'll go into a little bit more detail in the next slide. And again, once this initial process is complete, you will then reconsult with your physician. And again, they'll kind of highlight the medication protocol that they're recommending. The nursing team will then help to order these medications to a specialty pharmacy. And again, we'll be providing you a ton of resources, how-to videos. There may be an opportunity for you to meet your nurse in person to go over medication teachings, things like that. And then again, throughout this entire process, we will be reminding you what still needs to be completed. And then additionally, we do have on-call support, which is great. We do have a nurse on call on the weekends. So again, you're never really alone in this process. We're always here to help support you. All right, so part of your checklist, the main things that we will want updated will be an updated pap smear and an updated physical exam with the breast exam. And then for women 40 or greater, we do like to have a updated mammogram. Again, we just want to make sure that you are at your absolute healthiest before we get started with this process and before giving you any hormones. We will require medical clearances as needed. So for example, if you're someone with high blood pressure and you take medications, you will want to make sure that your physician that's managing this high blood pressure feels like you are safe to proceed with treatment with us. Again, for your egg retrieval, you are under light sedation. So we just want to make sure that any medication that you're taking, for example, is appropriately managing, let's say, your high blood pressure before going into that process. Again, your nursing team will be the ones ordering your medications and making sure that you have everything delivered before we get started. Once you get started on this process, we will be sending you medication calendars and we'll be frequently updating that. So you have the recommendations of your physician once you come in for those monitoring appointments. Again, you will be assigned a specific financial coordinator, which they will be in contact with your insurance, making sure everything gets approved. So they are a great resource to reach out for any insurance or billing questions. And then lastly, we do require consent forms to be completed. These are done online, but again, your nursing team is very knowledgeable at all the information that's contained in these. So please feel free to reach out if you have any questions completing those. Alrighty, and then just generally overview for the medications. So again, as Dr. Hirschfeld mentioned, there could be forms like birth control or other medications that your physician may recommend to kind of prep your body to respond to those medications that we're going to be using to try and grow your follicles. Again, in this webinar, you know, we can't pinpoint exactly which one of these medications you'll be on, but that's something, again, that your physician will discuss once you complete that initial workup. Then you will begin your stimulation medications, which again, most patients are on typically for an average of 10 days. Your physician may add in some extra medications such as growth hormone or a steroid to help promote the egg quality during your cycle. And then when your physician thinks that you are at that place to go ahead and proceed with your egg retrieval, that's when you will take your trigger shot. Again, throughout this entire process, your nursing team will be constantly reviewing which medications you should be taking each night, the specific dosages, and they'll also highlight how to give the medications. And again, we have a ton of resources to provide to help you make sure that you're administering them appropriately.
Thank you so much, Lindsay. We have Judy here next to talk you through the financial piece of egg freezing, including how to navigate costs and how much egg freezing actually costs at FCI.
Thank you. So egg freezing is covered by some insurances. Not all insurances will cover it, and that's when you will be a self-pay patient. But when you make your appointment and you give all your insurance information to our call center will give that information to our verifications department, and they will verify with your insurance if you do have coverage for egg freezing or not, and you will know that prior to your first visit with your physician. Illinois is a state mandated state for fertility coverage, which basically means depending on who you work for, where that company has their insurance underwritten, and several other things that go along with that, you will have insurance to cover it. Not all employees in Illinois have that. So again, we would have to determine that prior to your first visit when we verify your benefit. There is some coverage that would only include diagnosis, which means that you would be covered for all your workup prior to the procedure, but the procedure would not be covered. At that point, your financial coordinator would let you know how much it's going to cost you and what's included and not included in that package. Things you should know are the different types of fertility coverage that your insurance might offer. They might offer you, let's say, 2 cycles, you know, for lifetime. Some insurance companies also have a monetary cap, so it could be $20,000 per lifetime. There's certain insurance companies that can give you up to 4 attempts at a retrieval per year. So again, it just depends on what type of policy you have and what the coverage is. You also have deductible co-pays with that policy, and that's always good to know. Your financial coordinator will also discuss that with you. They do send you out a welcome letter with a printed out detail of your coverage. And if you have any questions or you don't understand something on there, you can always reach out to your financial coordinator and they're more than happy to go over things with you. Also know that there are certain insurance companies that do require pre-authorization for any type of service. And unfortunately, it's not up to FCI. That is your insurance company's requirement, and they can take up to 15 business days to give us that approval at times. Sometimes it can take more, depending on the time of the year. For example, the beginning of the year, very easily, it can take over 20, 25 days because they're so backed up with everything. Next slide, please. And just so you know, we do have financial options when you're paying out of pocket. We do offer self-pay packages that include your monitoring, your freezing, and the actual procedure. No medications are included in any of those self-pay packages. Medications are always separate. As I said before, you will be assigned a financial coordinator. Those are assigned based on the doctors, and any questions that you might have with how much something's going to cost. If you don't understand something about your financial coverage, your insurance coverage, you can always reach out to your financial coordinator. Usually, if you place a call to them, they do get back to patients within 24 hours. And if that's not the case, you can always call and request to speak to somebody else, and somebody will help you. They will help you maximize your insurance coverage. They will give you payment programs and discounts that are available that can lessen your cost if you are an out-of-pocket patient. There are programs, grants. We work with 3 different lending institutions that you can apply for loans with. There are a lot of grants out there also. And just so you know, if you are a cancer patient, the insurance companies will cover for you to have your eggs for the freezing, the yearly freezing. They will cover it at that point. Anything else, it would be out of pocket to you. They only cover for patients that are cancer patients. Next slide. I think we saw this one. Is that all that we have, Holly? Okay. So some financial considerations for you to take into consideration if you are a self-pay patient is the diagnostic testing. That is not part of your egg freezing package. That would be totally separate. Egg freezing cycle options, we do offer, like I said, packages, and there's you can pay for one, or we also have packages where you can pay for multiple cycles at a discounted rate. Medication cost is something that you would discuss with the pharmacy directly. Once your nursing team orders your medication, the pharmacy will reach out to you and let you know what that cost is going to be. Storage fees with the egg freezing cycles, the first year is included in your self-pay package. After the first year, then you would get a bill when the time is due from our freezing bank that does the storage yearly. And that fee, the yearly fee for that is $6.75. Once you decide to come back to use those frozen eggs for pregnancy, that is a separate cost. It is not included with the package fee that you pay for freezing. So you would have to pay for fertilizing those eggs and for the transfer. And that could be an estimated cost anywhere between $7,200 to $8,500 if you're self-pay. How much does it cost? Well, female fertility testing will run you an average of $500, and it includes your hormone levels that the doctors order and a baseline ultrasound. The egg retrieval procedure, which includes your cycle management, meaning you're monitoring your ultrasound labs, egg retrieval, the anesthesia, and the first year of storage. For one cycle, if you decide to do one cycle, it would be $7,500. 2 cycles, $12,500, and if you prepay for 3 cycles, it's $16,500. Medications can run you anywhere between $3,000 and $5,000, and again, that's just depending on what your doctor decides to put you on. The freezing fee is $850, and like I said, that is included with your package for the first year. After that, the yearly storage would be $675 per year for as long as you have them stored with us.
Great. Thank you so much. And thank you to all of our panelists today for providing these great insights. I am going to open up the floor to Q&A. So if you have any questions, feel free to send them to us through that Q&A button. I see that we already have some. And first question for either Dr. Hirshfeld or Dr. Burks, whoever wants to take it. What causes low AMH at a young age?
Wish we had a good answer for you. So most women who lose their eggs early or at a young age, it's from an idiopathic or unexplained cause. So women, when we're born, Dr. Hirshfeld said it, we have as many eggs as we'll ever have. Unfortunately, we're like losing them even before we have periods. It's just not a fair thing. But we lose them at a different rate. So some women lose them faster than others. Some women, unfortunately, in their early 30s, they're found to have a low ovarian reserve. If it was at the point where it looked like your AMH was below a certain level, then we would run a few things like autoimmune labs, thyroid labs, do a karyotype to see if there's any genetic cause, but most of the time it's idiopathic, so it's unexplained, meaning there's no good answer for why that happened.
The couple things to just be aware of, obesity can falsely lower an AMH level. So that's when we think ovarian reserve, we do it as a group of three, your AMH, your FSH, and the antral follicle count. We want really a global perspective. And tobacco is notorious for decreasing our ovarian reserve in a pretty substantial way. So there's so much in this world that we can't control, but it's not easy, but we can control and quit tobacco use. We can try to optimize being of healthy weight.
Thank you. Does embryo freezing work the same way as egg freezing? And what are the pros and cons of embryo freezing versus egg freezing?
So I can take this one. It works the same way in terms of you take the same medications, you have the same procedure, but you're different on the funnel. So the eggs are not frozen, they're fertilized. The con is if you're not currently in a relationship with a male partner, then that means utilization of a sperm donor. And for many, that's just not an option that feels comfortable. We can never unfertilize. So if you have like a set number of cycles you can do at a particular age, the advantage of egg freezing is it provides you the most reproductive options. And I would never advocate sperm freezing for anyone who'd feel uncomfortable using those embryos. We've now completely wasted your efforts and your energies and your resources. Somewhere around 38, 39, 40, there's some debate if going to embryos directly has improvement in terms of overall success. But again, it's the pro-con of being in a position where you have a sperm source that you're comfortable using and excited about using to create an embryo that would be an option in the future.
Thank you. Also for our doctors, so if someone freezes their eggs in their late 30s, is there a point where it's too late to use them?
Good question. So I can take this one since we're going back and forth. So eggs don't really expire. So that's a good thing. There's no like expiration date like the eggs that you buy at the grocery store. So they can stay as frozen as long as you want them to be frozen. Also good news, the uterus does not age like the ovary does. So you can carry a pregnancy much later in life, then you can use your ovary and your biological egg to create an embryo. So even if you wanted to use them in your 40s, you create embryos, we would do certain testing just to make sure we're setting you up for success as far as other characteristics that we know can put you at increased risk for things in pregnancy, like high blood pressure, things like that we know women in their late 30s and early 40s are at increased risk of, but that is irrespective of using your eggs. So you can use them at any time is basically the answer to that question. Sorry, long-winded answer.
Thank you. What is the average recommended age to begin the egg freezing process?
I say the truth is the younger you are, the better. That doesn't mean that socially time involved, the cost, but prime time to freeze our eggs is probably between the ages of 28 and 33. But women absolutely freeze their eggs into their 40s. You're just going to need more at that time. for creating opportunities of success.
What if you have embryos that aren't used? What happens to them?
So that's a very personal decision. You have options such as discarding embryos. If you're not ever going to use them, you can donate them to science. Or you can do something, even discuss doing what's called like a compassionate transfer with your doctor, which would mean transferring them at a time where you know you're not going to get pregnant, but that way so you don't have to discard them. So it's a very personal decision that everyone has to make. But it is something that the partners of a couple do need to be agreed upon. So it's something that is discussed before you even do an IVF cycle. So, both partners can discuss and kind of come to, agree on what they would like to do with their embryos.
I thought you were supposed to go off of birth control before starting an egg or embryo freezing process. Is this not the case?
No, it is the case for someone on prolonged birth control pills. Ideally, you should be off of them for 2 months. But in some centers, not ours, but in some centers, they do IVF 2 weeks of the month. And the only way to make that fit, to batch, is to use a birth control pill to fit people into certain slots. Some women, for various reasons, would use a birth control pill because they really want to do treatment this 2 weeks of this month, and their period doesn't exactly align. And so the birth control pill is a pause button. So being on it prolonged, like years on end, is different than using it for 1 week to fall into a certain time period.
This is a similar question. How long after a depot injection can you start the egg freezing process?
So I would say it really depends on when you get your periods back. So sometimes after depot, there can be a more prolonged time before you get your periods back and kind of get back to normal cycles. So we would want to wait for you to have normal cycles in order to use that for your IVF cycle.
Is there a big difference between 35 and say 37 or 38 years old as far as egg freezing goes?
Unfortunately, there is, right? So if you're 35, your goal is probably 12 to 15. If you're 37, 38, your goal is probably 20 to 25. And by 38, your goal is 25 plus. Each year that goes by, you're going to need more eggs for the same likelihood of success because the quality of the embryo generated is going to diminish. And so I say this all the time, but egg freezing is by no means right for everyone, but it's not like wine. It does not get better with time. If you're thinking of doing it, the younger you do it, the happier you'll be because you get the best return on your investment. The younger the eggs, the less we need, the more likely they'll work.
This is a question for Judy.
Okay.
Go ahead.
No, I was just going to say that because we don't know who's asking these questions. And so if you happen to be 38, I'm not saying don't do this. Please don't hear that. But I'm saying if you're 34 and you're debating, can I wait 4 years? My answer to you is no.
So this question's for Judy. Does the fee structure change if you are freezing embryos versus eggs?
No, it's still, if you're doing embryos, then the self-pay package fee is going to be more than the $7,500 because there's fertilization involved at that point. So that package is a different fee. The freezing and the storage, that would be the same fee, but the procedure itself would be more.
What is the first step in getting started with egg freezing?
So I would say first step is just making an initial new patient appointment, right? You come in, you meet your doctor, talk about medical problems, your history, talk more about egg freezing, and then you do your ovarian reserve assessment or testing. That's normally done with the beginning of a period. So you call with your period, then you come in for ultrasound and blood work day 2, 3, and 4. Anywhere in that day 2, 3, or 4 window. So then once you have those results, then you'll typically sit back down with your doctor. Now you can have a more individualized conversation, right? Where am I at? What is my ovarian reserve? Your doctor will be able to give you a recommendation as far as what IVF treatment protocol they recommend for you. And then after that is really kind of when we can go full steam ahead and get started. So then your nursing team would help you to order meds, sign consents, we'll wait for your next period. So really like from the door to when you can really do your egg freezing cycle, sometimes it does take like a month to 2 months before you can get started with IVF. So I think that's, I have had patients come and say, oh, can I start my IVF medications today? Unfortunately, we just can't do that. We would love to be able to do that for you, but we have to do the testing first.
When you say IVF medications, they're similar, right? Between
Sorry,
IVF.
yes, egg freezing and IVF medications are the same. Thank you, Holly. They're the
Nope.
same medications, whether you are freezing eggs or freezing embryos. So the process is very similar as far as the medications go.
And I think that this question fits in really well. Is there just one location in Chicago? We do only have the Chicago River North location, but we have 8 locations around. And are there other locations available for taking blood work? So something, and the doctors can speak more to this, but you can do your consult in Chicago. Most of our doctors do virtual appointments. And correct me if I'm wrong, but I believe they can go to any of our clinics to do their monitoring.
Absolutely.
Can you drink alcohol before or during this process?
Lindsay, do you want to take that?
Yeah. So you can drink alcohol before this process gets started. So during your initial workup, all that initial testing, once you actually start those egg freezing medications, you'll have to refrain from alcohol for that entire length that you're on it until after your egg retrieval. So the day following the egg retrieval, you are fine to resume alcohol, but the entire time you're on the medications will want you to abstain from drinking any alcohol.
Thank you. If you choose to freeze embryos instead of eggs, roughly how many would you recommend freezing to have a chance of conceiving one child?
I would generally say it depends on your age, because sometimes with embryo freezing, there is some additional genetic testing that can be done. And I definitely encourage specific questions. You should make an appointment to see one of us, because that way you'll get your questions truly answered. But usually it's 2 genetically normal embryos per desired child is kind of a good rule of thumb, or 2 high quality embryos for someone who's in a sort of a less than 35-year-old age.
Does recently having COVID affect egg freezing in any way, quality or quantity of retrieval, or how the body responds to medication?
So I think that's a question we don't unfortunately have all the answers to. Dr. Hirshfeld, please jump in if you think otherwise, but I think it's generally thought that it should not, greatly affect your egg quality or your response. But we just haven't had a lot of studies that have specifically looked at COVID and then like immediately jumping into like an egg freezing cycle.
Let's see. I think we might have gone over this, but in case there's anything more to add, how many weeks total would it take from the first consultation appointment to when the egg freezing procedure is completed?
I think I spoke to this, but I think you should probably plan like walk in the door to when it's all done, at least like a 2 to 3 month period, because it also, where you are in your cycle when you first come in. So it really depends on all of that.
Let's see. Does marijuana consumption have the same impact as tobacco smoking?
So when it comes to egg quality, I think tobacco is felt notoriously to be worse. The truth is, a lot of the studies looking at marijuana, we're not looking at sort of marijuana as it's prepared today. Some argue that it's, even though it's illegal, it's potentially more potent. I think, again, we cannot control our age. None of us can, even though that's the most important predictor, but these are all the things you can control. So in the process and the thought of preparing to freeze eggs, I would minimize to avoid cannabis. Alcohol should be modest. Try to be of healthy weight, improve your nutrition, improve your sleep, and stop completely tobacco.
So we talked a little bit about the timeline of start to finish, but like day-to-day commitment, you have to go in for monitoring. What's the time commitment there?
So once you get started on your medications, right at the beginning, it's typically on average every like 2 to 3 days. Once we get closer to that egg retrieval, you will need to be coming into the clinic every day for blood work and ultrasound. This does include weekends. Again, because the medications are really dosed based on how your body is responding to them, it's important that we're able to really closely monitor you so we have that optimal window to give you that trigger shot to prep you for your egg retrieval. So a good thing to kind of note is, again, just making sure that you are going to have a time of roughly 2 weeks where you're not planning any trips, to really just be around to come in on those days when your physician's recommending you to. Specifically for coming into clinics, as we kind of highlighted earlier, all of the monitoring appointments, you can go to any clinic except on the weekends. River North or a downtown location is the only one that is open.
Is back-to-back or are back-to-back cycles of freezing eggs or embryos a good idea?
Yeah, I mean, I think we are willing to work with you and whatever time frame, that works best for you. So if you want to do cycles back to back, we can figure out a way to do them in the shortest, amount of time as possible. As Dr. Hirshfeld mentioned, if you know that you have a really stressful time in life or in work, that's probably not the best time to do egg freezing. So then maybe, in February, that's going to be a good time. So maybe you come in and do all your initial testing, and then we plan for egg freezing in February. So we can adjust and do egg freezing, and make it fit with what's best for you.
Is there a way to test that we are freezing the best quality eggs and what the odds are that they will deteriorate or not survive?
So we only freeze what's called an M2 or metaphase 2 egg, because those are the ones that survive the thaw and fertilize at a high rate. And so that's what's nice about being at a place that's frozen almost 20,000 eggs, is we've looked at these parameters to be predictability. So age really impacts, but the phase of the egg when it's retrieved impacts as well. So sometimes people will freeze what's called an immature egg. So when an egg does its job before it's about to fertilize, it has to get rid of half of its genetic material. And that looks like a physical structure. It's called a polar body. When you see that under the microscope, that means it's a mature egg. And although some places will freeze immature eggs, their ability to mature post is really low. And we've seen that now because we used to do that practice and then we modified. So the last thing we want to do is mislead someone at numbers or freeze something that's not going to become high quality in the future.
Thank you. And so we've also talked a little bit about not smoking, limiting alcohol. Do you have an opinion on any other ways to optimize the body for an egg freezing, especially if there are low fertility levels?
I think just generally speaking, we want you to try to be as healthy as you can. So eat a healthy diet. People have asked, what is there a specific diet that is the best to be on? And I think the answer to that is we don't really know, but things to probably strive for are, good carbs, such as like wheat things, not processed foods, fruit, vegetables, like lean meats, fish, chicken, like anything that kind of fits into that like maybe more Mediterranean style diet. But I think just generally speaking, we just want you to, try to be healthy, try to avoid times of a lot of like additional outside stress. That's often not a good time to do an egg freezing cycle. So I don't know if you have anything else to add, Dr. Hirshfeld.
I think sleep is probably underrated, but really important. To do some type of activity physically every day, all of us should, 20 to 25 minutes plus. This isn't just in the egg freezing world. The truth is, this is all the time. We should probably avoid eating and drinking out of plastics. Even BPA-free plastics will leach into your foods and they can be pretty bad for egg quality. And then you have to be careful because you can go on a deep dive and then kind of get nutty about this stuff. But You should really look at what's in your beauty products, in your cleaning products. You should minimize, if you can, like phthalates and parabens. So those would be the other things.
Thank you. Does male infertility affect the quality of the embryo for egg freezing?
Well, for egg freezing, we are, purely freezing eggs.
Sorry, embryo freezing.
Yeah, but for embryos, it can affect how many eggs fertilize. So when you get to that step and you have some sort of male factor, and it depends, there's different types of male factor and different severities, it's spectrum, but it can affect how many eggs successfully fertilize.
This is a really interesting question. How long is the ovarian reserve testing good for before you would need to go in for another one?
We generally think it's valid for about 1 year.
So I think maybe Lindsay or the doctors, whoever thinks this is best suited for you, are there any long-term risks to using stimulation drugs, any high risks for diseases or cancers in the future?
So, generally speaking, there has been studies, as I mentioned, that the meds for egg freezing and IVF are the same. There has been no link shown in studies being on these meds for cancer, breast cancer, ovarian cancer. So they are generally thought to be safe and to not increase your risk of either of those things.
I think there was a recent larger study that also showed there was no relationship to things like colon cancer. I think what's important is these medicines are from like the 60s. They didn't come up with this like a week ago.
Yeah.
And there's long-term data, particularly globally, got a Scandinavia, just based on how their healthcare system works. So they've been vetted pretty well. What is a known increased risk of breast and ovarian cancer, unfortunately, is infertility. It's the absence of having children. It is the age you are when you have your children, if you're over 35, and if you do not nurse. So those independently are things that can impact risk factors of those diseases.
Thank you. So just a couple more questions. Are there any prescription medications that can be detrimental to this process or that you should stop taking before this process starts? Like if you're on anxiety medication or migraine medication, something like that.
Yeah, I think so. I mean, we know that there are medications that are considered pregnancy safe versus not pregnancy safe, or medications we know are more safe to be on. So, that's why it's important when you come in and we go through all of your medical history, what medications you're on, and then we'll go through those things one by one. I think it's hard to say or to list right now, like what all medications could potentially be detrimental, but that is something that you and your doctor would discuss. And if there was something that you were on, for instance, like certain acne medications shouldn't be used when you're trying to conceive, or thus doing an egg freezing cycle, we would advise you to get off them. But we would go through all your medications one by one.
I do think it's important to note, like the majority of medications, it is the issue when you're pregnant that they go through the placenta of the developing fetus. The majority of medicines actually can be maintained in egg freezing. So there's a subtlety there that is important that you review, just like Dr. Burks Chatmon had said, when you see your doctor. The majority of meds when it comes to egg freezing do not need to be stopped, but those same meds often do before you actively want to be pregnant.
Great. And we are just about at that 6:30 point. And so I want to thank all of our panelists for participating today. I want to thank our guests. I want to thank you for all of your awesome questions. I hope that we got to your question. And I know if you have any other questions, you can always feel free to reach out to us. I believe our email is in the response that you got from your registration, but it's fcimarketing@fcionline.com. You can always ask us more questions, and if we're able to answer those, we will. And again, this was recorded, so we will send this out to you within 24 hours. And just thank you again. And I hope that everyone has a wonderful rest of your night.
Thank you.
Thank you. Bye,
Thank
everyone.
you. Bye,
Bye.
everyone.
Thank you.